September is Ovarian Cancer Awareness Month, and this is important because almost 80% of women diagnosed are in advanced stages of the disease. That's when the prognosis is poor. The National Ovarian Cancer Coalition is focusing on earlier awareness of symptoms and the fact there's really no early detection test. Joining me now are two OBGYNs from Ascension Providence, Dr. Erin Waite and Dr. Michelle Manning. And it's great to have you both. I mean, I normally don't get two doctors, and this is wonderful, but it's such an important thing because, you know, as I said, I mean, it's found too late.
It is. The symptoms of ovarian cancer are so vague, especially in the female population. So the top four are bloating, some abdominal pain, changes in bowel function, usually constipation, and getting full early when you eat. Well, okay, I've had all of those in the last couple of months, once or twice. So how do you put that together and decide, hey, I need to talk to my doctor about this? So I think some of it's being aware of your body and noticing when there are real changes, and then going to talk to your gynecologist and say, is this something I need to worry about? Is it not? When do we need to look into this?
You know, Dr. Waite, how are they kind of looking into this? What is the best?
Well, naturally we want to let people know what they can do to kind of prevent or decrease their risk or prevent possibly getting ovarian cancer. And when you come to your annual visit, one of the things that we discuss is your family history of cancer. And so we'll give you a little sheet to fill out. We have you put in like what members of your family have had what cancers, and then we determine if you're a candidate for genetic screening. And so if you're a candidate for that, then we have measures that we can take to screen you. Or we can talk about procedures that can reduce your risk as well, and that was something that we wanted to talk about today.
Yeah, and this is something that was news to me, and that's that to remove the tubes as opposed to the ovaries.
Right, so as Dr. Waite was talking about, when we take that family history, we're trying to identify people who may carry the gene, BRCA1, BRCA2, and then a slew of other ones, but those are the big ones that people have heard of. And what they found is we have found a lot of those ladies, and to try and prevent their very high risk of the disease, we take out their tubes and ovaries early. And when we're doing pathology studies on those tubes, we're finding that there is a lesion very similar to ovarian cancer, what may be early ovarian cancer that's actually in the tube and not on the ovary. And maybe we're finding it late because that tube is sprinkling it down into the pelvis. So we've always known that there was a little bit of a decreased risk of ovarian cancer if you had your tubes tied. Now we think maybe we should just take them out. So what they're saying is for the general OB-GYN, if you are in the pelvis, in the abdomen doing something else, and the woman no longer wants to have children, go ahead and take those tubes out too. It's not going to add a lot. It's not going to add anything to her recovery. It's going to add a very minor risk to the surgery itself, but it may decrease that risk long term. It's a theory, but it's a good theory. It's got some good data behind it.
Fascinating. I mean, and of course, the point of an awareness month is to become aware. And if
That's
you
right.
haven't had your yearly visit, time to call your doctor. So how can folks get in touch with you, Erin?
Well, we are through Ascension Providence. We're the Ascension Medical Group for Women's Health. We're over on Highway 6. I've only been here a year, so I don't know about the old Target.
Yeah, we're glad you are.
She threw out the old Target building when we were on the Facebook Live, and so I'm like, great.
That's where we are.
But it's always been there for me.
Very good. Yeah, the bottom line is that find it early, because then the success rate can be a lot better.
Absolutely, yeah. Stage 1 is good.
All right, thank you so much, Doctors Waite and Manning, for being with us.